let's move then to this particular conversation. While South African doctors are hard at work as numbers spike during the fourth wave, the South African Internationally Trained Health Professionals Association has raised concerns that foreign doctors, mainly from other parts of the continent, appear to be employed in public hospitals ahead of the local doctors. The organization also won a significant court victory recently for members who have studied overseas but were reportedly denied seamless integration into the local medical fraternity. Let's speak now to the organization's Advocate Rene Govender. Advocate, good evening to you and thank you so much for your time. Let's talk about, this particular disturbing development. There's a need in South Africa for trained medical doctors. Then why are local doctors being overlooked?
A very good evening to you and thank you for having us. This saga started some 4 years back, around 2017, 2018, where returning doctors of South African-born doctors, having obtained their qualifications overseas, were faced with many challenges and many hurdles before they could register for practice in South Africa. And we found this strange because the country was facing a massive shortage of doctors. And these doctors didn't go to fly-by-night institutions elsewhere in the world. They went to, they attended and obtained their qualifications at institutions that were listed in the World Directory of Medical Schools, as well as they had their qualifications authenticated and verified at the ECFMG, and that's a commission, an educational commission for foreign-based doctors to authenticate and verify their qualifications based in America. So it was quite alarming that the HPCSA, together with the National Department of Health, in 2018, created two major stumbling blocks to block entry or registration in the category of internship of these doctors. The first hurdle was that the HPCSA demanded that these doctors produce a certificate of internship before they applied for registration. Now, we found that strange because these were doctors of South African origin. They had come back home after obtaining their qualifications, and the legal framework allowed them to register in the category of internship. Now, if that was not enough, the Department of Health then issued a policy guideline that instructed these doctors to obtain a year of clinical rotation program, to attend a year of clinical rotation program at a South African university before they applied for registration. Now, both these issues collided, and we had to then take up the cudgel on behalf of these doctors, which we did. And a political solution was reached, and these doctors were then allowed to write the board examination. However, that was not enough. Come the third major hassle. In June 2020, the HPCSA then issued a guideline, which we refer to as the New Pathway Guideline, which we contested in the Pretoria High Court. We have interdicted the HPCSA from implementing that guideline. We won a court order in October of this year, in August of this year. HPCSA did not wish to implement that court order. We went back to court and we then got a contempt order against the HPCSA to allow at least 108 doctors to write the board examination. Now, we are actually dumbfounded by all of this. Why is the HPCSA, the Department of Health, who is the custodian of the legal framework within which the HPCSA operates, is creating these hassles?
Pardon me, Advocate Govender. One of the things that I'm hearing you say, you're painting a picture of these stumbling blocks, and really it boggles the mind that if they've got qualifications that are checked and have been listed with the Medical and Dental Professionals Board, then it's very strange as to why then this is happening. So who is then being employed in the space of these doctors that are supposed to be integrated into the South African medical fraternity?
Well, we've been successful in terms of the court orders and the actions that we've taken on behalf of these doctors to get many of them to rights. And the association alone has created a space for about 300 doctors to have written the board examination since we came into operation. So that alone tells us the success rate that the organization has had. We've taken these actions on behalf of doctors, other than court actions as well, meeting with the HPCSA and negotiating with them a pathway that will allow these doctors to write the board examinations. But having done all of that, we still find a major stumbling block once again. The HPCSA, unfortunately, does not recognize a number of universities, although they are world recognized. They are listed in the World Directory of Medical Schools. The qualifications obtained at these universities are accredited and verified. The HPCSA now wants a further requirement that these medical schools must be recognized by 2 international regulatory councils. Put it in simple English, by 2 further medical councils. Now, these international medical councils are not providing us with that recognition letter for the simple reason it is outside of their jurisdiction.
So, Advocate Govender, I wonder then if what you're just describing now is the reason why your organization then is saying that doctors from other parts of the continent are being prioritized over doctors from South Africa?
It seems so, because we have now raised the question of why doctors from the continent are being integrated into the system in an almost seamless process. What is it that these doctors are now required to do, as opposed to our doctors coming from, who have obtained qualifications from other countries such as Russia, Ukraine, China, Mauritius, and so forth? And that's the question we are asking. We are also asking the question why board exams are being, the focus and the format of board exams are being changed to suit a certain cohort of doctors. Now, you must realize that our doctors coming in are 6th-year medical graduates, whereas those coming from the continent seem to be specialists or seem to have years of experience. Now, all of these doctors, those who have specialized training and those who are specialist physicians, write the board exam together with this 6th-year doctor who's just come out of university. And that is a cause for concern, because everyone is writing the same examination, which means that those who are specialists and coming from the continent, or non-nationals who are specialists, are writing a board exam, sitting together with a 6th-year university graduate, just out of university. That's that kind of experience.
All right.
So,
unfortunately, Advocate Rene Govender, we've run out of time, but thank you so much for just putting us in the picture about these difficulties. And really, it'll be interesting to hear even from the HPCSA on exactly what is going on here, because these barriers to entry sound very, very hectic, especially for a 6th-year medical student who's really hoping to get some internship and start being able to practice as a doctor. Thank you so much for your time this evening. That was Advocate Rene Govender, who's the legal desk chairperson at the South African Internationally Trained Health Professionals Association. Let's now